Hi, I'm Jenny Davies from Beaches Pelvic Physio in DY. I'm a pelvic health physio, as are my three colleagues who work here. We treat everything to do with the pelvis, both internal and external. So external things we treat are things like back pain, hip pain, pelvic pain, groin pain, abdominal separation for our new mums, deep core retraining, all that to do with that part of the body. Internally, the work that we do, that not many people know that physios treat this, and we are a specific kind of physio, but we go internal and we treat things like leakage of the bladder and the bowel, urgency of the bladder or the bowel, which is where you're racing to the toilet, like your bladder's suddenly screaming at you, you have to go, or your bowel, or you're scared of where the next toilet is, so you're going frequently just in case. We treat pelvic organ prolapse for the women and pre and post operative work for prostatectomies and hysterectomies, cyst removals. We treat internal pelvic pain for things like endometriosis, the side effects of menopause, and we do good old bog standard pelvic floor training, deep core retraining, returning people to sport, all that sort of stuff. What I'm going to talk to you today is about the pelvic floor, about what it is, where it is, why it's useful, and why we should know that it exists. Men have one as well as women. It is slightly different for obvious reasons, but they are basically the same thing. Now, I'm going to show you the pelvic model here because it's the easiest way to explain it. I do have to say this is a female model. We don't have a male model. Unfortunately, men's health, pelvic health, is about 10 years behind women's pelvic health. The models don't exist yet. They will do, but they don't at the moment. So I have a nice picture to show you for the men. So for the females, well, for everyone, we've got the pelvis. We've got three bones in the pelvis. We've got the ilia, these two big wing bones on either side, and we've got the sacrum at the middle at the back. This forms, so if I turn it around, the sacrum comes down into the coccyx. So we've got our sacroiliac joints on either side there, and we've got a pubic symphysis at the front. Now, excuse the full frontal view, but I'm going to tip it upright. These are sitting bones, and all this red area here is pelvic floor muscle. It's a group of muscles that covers the base of the pelvis. Like I say, this is the female version, and this is the male version of exactly the same view. So you can see both of them have this superficial layer at the front, this triangle that comes into the perineum, wraps around the anal sphincter, and some of it attached onto the coccyx. The deeper portion of that superficial layer also wraps up around the urethral sphincter, which is where the urine comes out of the bladder. The deep layer attached off the pubic bone at the front here, part of it wraps around the anus and comes back up, forming this U shape. The rest of it attached off a wider attachment and comes back onto the coccyx. Separate nerves supply to each side. So we've got two halves and two layers. For women, a contraction will feel like you're squeezing in for this superficial layer and you're lifting up and forwards for the deep layer. If you're pregnant, it'd be that feeling of lifting the baby up towards your heart. There's many different descriptions you can use to describe the pelvic floor contraction, but in essence, it's that squeeze in, lift up. For men, it's slightly different. There's three cues that we use. So we talk about a squeeze in around the anus and that lifting up as well. Then these muscles around the base of the penis here by the testicles, we want to lift the testicles up. We affectionately call this nuts to guts. But it's that feeling if you're walking into cold water that you're lifting everything up to keep it away from the water. The third cue is that you're drawing the penis inwards into the body. And that creates a sort of pincer mechanism across the urethra for men, which can stop the leakage occurring. So slightly different mechanisms, but in essence, the same thing. Now, where the pelvic floor are really useful, they have a few different functions. They obviously, like we've talked about, wrap around the urethra and anus and help continence. They support the pelvic organs, so they're kind of in a V shape. When they're working well, they're in a V shape. If they're weak and lengthened, they sit more of a bowl shape. Now, if they're weak and lengthened, and if my head was the pelvic organs that sit inside the pelvis, obviously, you can see there's a lot more room for them to move around. If the pelvic floor is nice and toned and firm, there's much less room for movement. So they support the organs in position. This can help minimise prolapse symptoms for the women. They aid sexual function, so erectile function. They're part of the orgasm response and part of the pleasure response in all ways. They're essential part of the deep core. So lots of people talk about core stability. Your true core is your pelvic floor underneath that links with your deep abdominal and back muscles and your diaphragm over the top. They should work together in a coordinated fashion to support your trunk. This can help minimise back pain and dysfunction around the back and pelvis and hips. Symptoms of pelvic floor weakness are really, really common. Not many people talk about it, but they are really common, but they are not normal. Now, your typical symptoms are, like we said before, leakage, heaviness, dragging feeling, pain, urgency to go to the toilet, not being able to stop the urine once it starts. All very, very common, but not normal symptoms. If you were to talk to your friends, about 30 to 50% of them would have issues. They may not talk about them, but they are there. So I suggest you talk to them. Start the conversation. Because the good news is that treatment is available and the symptoms, they respond really well in general. Like 70 to 90% will respond really well to pelvic floor training. I'm going to go into pelvic floor training towards the end of this talk, so you know what you're doing. But it's worth trying that as your starting point. Worldwide, it's recognised that pelvic floor training is the first line of treatment for leakage. Like I say, it has good effect. It doesn't work for everyone. When it doesn't, that's when first off, if you've tried pelvic floor on your own, you'd see a pelvic health physio and see if you're doing them correctly, see if it is the appropriate thing for you to be doing. If that then fails, then we get referrals on to specialists for further testing or possibly surgery, and investigate different approaches that we can use at the higher level. But your first stage is pelvic floor training. It's simple, it's easy, it does take time. It takes 8 to 10 weeks to see a significant strength difference. Whether you're training your muscles in an elite athlete or whether you're training your pelvic floor. So it's not going to happen quickly. It requires some dedication. They are not very exciting exercises. I apologise for that. I would love them to be exciting. They're not. There are different gizmos and gadgets that you can get to support that. The most basic of which is a really simple app called Squeezy. It's done by the NHS in the UK. It costs about $5 to buy. You download it onto your smartphone. You can set an alarm that reminds you to do your exercise, which has a snooze function. Then you put in your program, you press play, and it's got this little visual that squeezes and lifts, and it times you. So it times you how long to hold, how long to rest, how many to do, and records what you're doing. So it's very, very simple, very effective. $5 well spent in my money for exercises that are not exciting to do. So that's my top tip with pelvic floor exercises. Download Squeezy and get onto it. They have a Squeezy for men and they have a Squeezy for women. So on to pelvic floor exercises. What you're going to do with your pelvic floor for women, that squeeze and the lift. For men, the squeeze and lift, but also thinking about lifting your testicles up, drawing the penis back into the body. Now you're going to try and hold that for 10 seconds while you breathe normally, just a normal relaxed breath. If you can't hold it for 10 seconds to begin with, don't worry, hold it for as long as you can and rest. As you get stronger, you'll start holding it for longer and longer. Your aim is then to repeat that 10 times within the one session. You only need to do this once a day, but once a day, do it really, really well. So you're aiming for a 10-second hold, 10 times, and eventually doing that 10 by 10 for 3 sets within that one session. There are many more fancy ways we can approach the pelvic floor. We do quick ones, we coordinate it with movements, we do specific parts of the pelvic floor, but for now that is your bog standard basic pelvic floor contraction that will get you on your way to being stronger. Remember, it is going to take time. It is going to take 8 to 10 weeks to see a significant strength difference, so don't expect results tomorrow. It requires dedication, but if it's going to work, you will see results happening. Usually you'll see results happening within 3-4 weeks. Things will start to change and you know you're heading in the right direction. All right, if that's not working, like I say, you need to get in touch with a pelvic health physio and get a proper assessment and see that it is appropriate for you to do that, and that you are doing it in the right way. Lots of people think they're working it well, but actually they're not. Or they're not working it strong enough, or only one side of the pelvic floor is working, not both sides. So that's where the assessment comes in to help you. People are embarrassed about talking these things. That's fine. As pelvic physios, we talk about wheeze and poos all the time. It is our normal conversation day to day. There is nothing you can say that will embarrass us. We have heard everything. The stories that I could tell you would amaze you, so seriously, don't let embarrassment stop you from getting treatment, because from our point of view, we want you to tell us these things, because we're often the only people who will ask those questions. So please come and tell us your story, so that we can help you improve. And obviously everything stays completely confidential within treatment walls. With whatever medical practitioner you're seeing, everything is fully confidential and will not go outside those walls. So in terms of embarrassing things, it's going to stay put and confidential. All right. Now, in terms of getting treatment at this point with COVID and everything going on, most physios are doing telehealth consultations as well as face-to-face for essentials. We do combinations where we do the talking part over phone or video link and then see you just for the physical assessment in the clinic, or we can do all of it in the clinic. We're spacing everything out so that there's only one physio, one client in the clinic at once, and it's all fully disinfected between times. I will wear a mask when I'm doing any close contact, as will my other physios when we're doing any close contact work, to protect us and to protect you. So if you have concerns regarding that, rest assured that we are taking every precaution possible to minimise the risk of infection. If you would like to get in touch, if you do have any other questions, then please, you can contact me at jenny@beechespelvic.physio. So Jenny, which is Jenni, at beechespelvic.physio. No .com.au on the end, it's just .physio. Or you can give us a call on 0435 150 136. If you're not in area and you want a recommendation to a pelvic health physio local to you, we can do that too. We have links to all our colleagues. So look, if you've got questions, please get in touch. Otherwise, I hope that's been helpful for you. Stay safe and healthy in these next few months as the craziness continues. And I look forward to seeing you soon if you need assistance. All right, thank you. Bye.